say guidelines?
45's Coronavirus Guidelines for America. I did think this was a good thing to read on today's show because a lot of us just, some people are still playing. You know, there's some people going to the beach. What else?
The college kids had to get
they had to get their spring break on.
What one youngster, he was like, I don't care, man. If I get it, I get it. I'm partying. I've been looking forward to this for and I can understand that, But
we gotta be safe.
When you're young, you're like, I'm untouchable. What? Look at me over here.
Yeah, we gotta be safe. Safe. So you can do the first one.
Listen and follow the directions of, they're saying listen and follow the directions of your state and local authorities. That's not a suggestion. That's not a suggestion.
Yes, follow.
That's a listen and follow.
Follow it. Because if we don't... No, for real. If we don't follow what's being put out, it'll get worse. What happens is when you're in a shelter-in-place ordinance, that's like your first layer of protecting your community, the society.
True enough.
And if we start jumping out and doing more things or disobeying those kind of rules, it can move into, the National Guard, and then it's going to be like an outbreak situation.
Well,
and that's a whole nother story.
You know what? See, that's the deal. They really haven't waited. Wait
a second, Nathan, we're talking.
They really haven't waited for it to get really out of hand. They're already moving in on self places. I'm sure
they're on guard already. The
soldiers in the tank. So
let me read the second one. If you feel sick, stay at home. Don't go to work, and that's for the our what do they call it? Not special needs workers, but essential workers. So
and
that's like your nurses. That's
you either are essential or you're not now. How do I feel about that?
Yeah.
How do you feel about that? We have essentials and non-essential.
My heart goes out to the essential workers right now because you have to go out on the front lines and deal with some of this. There was I saw a video. I actually shared it on my Facebook. There was a nurse who was explaining what she was seeing in some of the hospitals, and she was like, "This virus is more serious than you think. Stay home. Do not come out." We're at the place now where we have to separate between people who have the virus and don't, because they're getting exposed by coming in to deal with whatever their ailment is. And then she's like, "I'm not even going home. I'm going to a hotel so I don't expose anything to my family. So I'm not gonna see my family for a couple of weeks." So this is deep, and that's nurses, doctors, grocery store workers. There was even a news report where two doctors, it's a house full of two doctors and they have kids, and she was saying she updated her will just in case her or her husband caught the virus while working, so their kids could be taken care of. I thought that was so. I was just like, wow, this is deep. So
and man, I never thought about that.
Yeah, you don't think about that. Oh, you got something coming.
Wills. I never thought about that.
Yeah.
Do I need a will right now?
Yes, you should have one.
I'm 40. I got a child, my beautiful son.
Yes.
Man,
I have a little something set up. I have a little something set up for in the event. If your children are sick, keep them at home and contact your medical provider. And what they've been saying is you have to get with the advice nurse on the phone, and they'll give you information on how to quarantine them properly and what you should be doing. This is a big one. If you're an older person or have a serious underlying health condition, stay home and away from other people. The biggest thing with this one is people who are most susceptible to contracting this are elders. Now, some of the numbers were like 65 and up. So if you're really like in that 65 range and even older, you have to visit your grandparent by looking through a window and wave, because if they can go, our elders can go down very quickly if they catch this. They won't have enough to fight it off. And then also people who have other ailments, like even me as a diabetic, I have to be careful. Someone like me who's a diabetic, I have to be very careful with what I get exposed to, because as a diabetic, sometimes people who with diabetes die from the complications. They die from infections because their bodies can't heal quick enough. So that's something really important. Someone who has a weak immune system or has a chronic disease, be careful. Stay indoors. Quarantine. Do not get out. Please be careful. If someone in your household is tested positive, keep the entire household at home. So that's a big one. You want to read some of those?
If someone has tested positive, you know, the whole test positive thing really needs to be cleared up.
Yeah,
because here where we live, there was a lady that posted that she was feeling some kind of way. Right. She was a home care worker, and she went to our local hospital. I'm not going to put them on blast, even though they need it. But she went in there. They said, you know, you got to go. Yeah. We understand that you're feeling some kind of way or whatever. I don't think they even tested her. Yeah. They just
One thing they've been saying, too, about the test kits is they don't have enough test kits.
Right. That's the excuse.
And that's the big thing right now. I know there was a whole big thing online, actually not online, on the news, where they were asking the president to get a hold of 30 to 40,000 ventilators because this is a respiratory disease. It impacts your respiratory system. And he was like, you guys should just be able to work with what you have. But what the doctors were explaining is that because there's so many cases of people who have the disease already, and a lot of people are saying it could cause longer term damage even after the disease is healed. It's going to take a while for your lungs to come back. Those ventilators are going to be needed to help with the breathing. So we're in a kind of epidemic where we're in the middle of the disease and we're trying to get the test kits. We're trying to get all the testing things in line in place just so people can get properly tested. So.
But you know that kind of flips me out because
topics. So was there anything else we're supposed to read on here? Yeah. Okay, so work or study from home whenever possible. Avoid social gatherings in groups of more than 10 people. Avoid eating or drinking at bars and restaurants. Use pickup or delivery options. Avoid discretionary travel, shopping trips, and social visits. And like I said, that's a big one. When I went to Target, I got my the things I needed. We needed to get like some more cheese and some more stuff for our sandwiches so we can have foods that we can eat during the day and then things that we can cook. And then I did buy some drapes, even though that wasn't like a necessity, but when I was at Target, it was available, so I did get it. But technically that falls under that, so I need to make sure I kind of curb that myself. Do not visit nursing homes or retirement or long-term care facilities.
Which is, that's kind of wild because I just found out that my grandma is in one of those kind of facilities.
Right now.
I don't know what that looks like. And one of my relatives is up there with her, so... And
they're kind of quarantined.
I just pray that doesn't turn out to where coronavirus has anything to do, I guess exposure it's airborne.
Yeah.
So I guess you get it on your hands or whatever, to somehow it gets within your system. I'm still not sure how that goes. They say wash your hands.
Stay
6 feet from...
6 feet. There was that one meme where it showed either stand 6 feet apart or you'll be buried 6 feet underground. That's what one, and that hit me hard when I looked at that because you hear there's a quote unquote cold going around and you're just thinking, oh, okay, we'll be fine. But this is a little bit different. Like I literally had to go watch Outbreak on Netflix just to prep my brain to understand the seriousness of this.
Oh yeah, I'm glad you brought that up.
Yeah,
because it wasn't even long. It didn't take Netflix to see. And that's another thing I believe in is that they show us what they got going on in these movies.
Yeah.
And just as soon as all this stuff started happening, they had like a playlist of 10 movies about this same scenario.
Yeah, pandemic. Outbreak. Care unless to provide critical assistance. Always practice good hygiene. Wash your hands, especially after touching any frequently used item or surface. Avoid touching your face. And I have it really bad because I'm always like trying to do stuff and gotta remember, don't touch your face. Sneeze or cough into a tissue or the inside of your elbow. So like
inside.
Like that.
What is that?
Yeah, like that.
You gotta dab it.
Yeah. Sneeze. Okay. And then disinfect frequently used items and surfaces as much as possible.
My guitar.
It says go to coronavirus.gov for more information. And then in the blue, it has this: even if you're young or otherwise healthy, you are at risk and your activities can increase the risk for others. It is critical that you do your part to slow the spread of the coronavirus. So I hope that helps.